But I just wanted to give us a little bit of context around infection control concepts, because this can get a little abstract. And so the more you look for ways to contextualize it, the more meaningful it will be. And you'll kind of have some things to hang some of these more abstract things up against. So as we're walking through this, I'll make sure to try to keep this as real world and as in the hospital and as much in the lived experience as possible. I love the one of the first sentences in this book. It says, "As hospitals are gathering places for the sick, they are also focal points for the transmission of disease." This is a joke that we used to tell a lot of times around the department. Man, this would be a great place to work if it weren't for all the sick people, right? I don't know how much more crude a textbook can be, but it's pretty close. So that's what we're dealing with, right? How do we work in this place full of sick people without becoming a sick person ourselves, right? And so here's our learning objectives. We want to classify microorganisms, look at their physical structure, and give examples of each. And this is not a microbiology course or anything like that, right? We just need to define some terms. We're going to talk about how we treat viruses and why they are so difficult to treat. And even maybe meditate a little bit on why on earth did God make viruses, right? Because they are strange. We'll list some factors involved in the cycle of infection, so we'll get into that cycle. Talk about opportunistic infections, and those are the ones that we really want to avoid. We're going to talk about virulence factors, possible reservoirs for infection, in other words, things you want to avoid. Talk about portals of entry, routes of infection, and talk about the three basic ways that we can be protected. So here's some key terms, right, that we'll be defining. It's also found in the chapter. And I would say that in terms of where we're learning, what area are we learning this material, the key terms are really probably the most important thing. The one more kind of critical thinking piece to this is that process of infection, that cycle of infection. So if we got the key terms, we're pretty much good to go. All right, microorganisms. So looking in the textbook on page 133, we have microorganisms can include things like normal flora, right? It's not here on this list, but that's stuff that lives on or inside the body. We mentioned that a little bit last week. Anything that causes a disease we'll call a pathogen. So if it's one of these little guys and it causes a disease, we'll call that a pathogen. So one of the first that we'll consider that are pathogenic are bacteria. And these are very small single-celled organisms. They have to have a cell wall to survive. So most antibiotics are designed to destroy the cell wall of bacteria. I think a lot about, what's that Natalie Portman movie where she's like out in the jungle and she's fighting this thing that keeps changing its shape? Yes, Annihilation. Yeah, based on, I think, Jeff Vandermeer book. The book's really great, too. But I think about bacteria when I think about that movie, and particularly antibacterial stuff, because that seems to be what the movie is kind of getting at in part, is like these weird relationships where we have to like attack the cell wall in order to attack the thing. These bacteria grow independently without a host cell. So that's one of the things. They're very, they kind of grow everywhere. And they have these different shapes. So there's spherical shaped things, which we call cocci, spiral shaped things called spirella or spirochetes, and then also rod shaped ones, which are bacilli. So that if you see those terms, just know it's describing its shape. It's a scientific term used to describe the shape of the bacteria. I wouldn't get bogged down in the gram staining or whether it's anaerobic or aerobic. What we really need to know are what are the ones that we need to avoid, right? And so that's on page 135. Some examples, right? Tuberculosis. We're going to be talking about tuberculosis a lot. Why? Because as X-ray techs were called in to diagnose tuberculosis. And so I think maybe Mr. Wolf talked a little bit about TB last week, I'm not sure. But he probably differentiated between active TB and like an inactive or kind of a strain of TB that's not fully contagious. So it can be contained within the body, right? And TB is, interestingly enough, one of those things that's on the rise here in the United States of America. So it's something to be aware of, and in general, if you've got a patient who's coughing a lot, instruct them to wear a mask, right? But you may be asked to do a chest X-ray on someone who it says positive TB test, or perhaps they're unable to receive the TB test because they're allergic to something related to the testing. So in that case, again, just practice universal precautions. If need be, if they're coughing, actively coughing, ask them to wear a mask. Strep throat is another example of a bacterial infection that we commonly see in the hospital. And then E. coli. So those are three that we're commonly asked to work with patients on. Rickettsia are bacteria, but they're atypical. They're smaller, and they grow inside the cell, which is really creepy, right? Like their environment is inside of other cells. So there's cells that grow inside of cells. So things that we're worried about with that is Rocky Mountain spotted fever and typhus. Viruses, I said, are one of the most difficult ones for us to detect, right? We can look for signs and symptoms related to virulence or related to the body's immunological defense for viruses. But these are subcellular organisms, and they're among the smallest disease-causing organisms. Interestingly enough, viruses are also the reason that we know that DNA is the code of life, right? Because of research by Hershey and Chase trying to determine what exactly are viruses passing on to cells. And so they were able to identify that DNA, because prior to their research, we thought that it was RNA that was the essential code of life. But probably the most common one that we worry about is hepatitis, right? So you get those notifications from the school nurse that you got to go get your hepatitis vaccine and all that, because you're dealing with a sometimes really dirty environment, right? And so if we can inoculate you, if we can expose you to an inactive form of the virus, your body can form some active immunity to it and be able to fight it off should you receive an active strain of the virus. But other things that we worry about are Epstein-Barr virus and varicella, which causes chickenpox. All right, fungi. All right, there's always a joke in here somewhere about like which of these things like to party or whatever. But the fungi are things like yeasts and molds, and they basically are, the botanist would kill me for saying this, but they're like tiny plants, right? It's like if you're growing mushrooms inside of you or something. So pneumonia is actually one of those things. PCP and candidiasis, right? These generally infect people with compromised immune systems, right? Like a member of my family recently, one of the older members of my family, got pneumonia, and she just said, I feel like a little old lady now, right? It's like little old lady disease. Because why? Because our body's normally equipped to fight off the fungi, but as we age, that immune system starts to become less responsive, and so we wind up becoming infected. Prions are not fully understood. They're the most recently ones, and we think about them as possibly infectious proteins. And so they may be there to explain certain things that used to be thought to be congenital or hereditary diseases, like Creutzfeldt-Jakob disease, may be caused by prions. Another example of something that we're questioning whether or not prions are involved is Alzheimer's, right? So as you're watching the news, I know that's a really a hot button thing. We probably all know someone who's been affected by early onset dementia or Alzheimer's, and prions are possibly one of the culprits associated with that. Finally, protozoa. And the name protozoa, I think it's Latin for like false foot or something like that. It's kind of gross, but it's basically something that's able to move. These are all those things that you get from drinking water in foreign countries, right? Like Giardia, right? Well, honestly, you can get Giardia from drinking water here in America as well. But if you're drinking stream water, you have to watch out for these types of things. They're toxoplasmosis, right? So anytime we're suspicious of a protozoal infection, we'll start asking questions about, okay, have you been out of the country recently? What kind of water were you drinking? Those types of things. All right, here's that cycle of infection kind of mapped out for us. So all of these things have to be present for an infection to occur. So generally the way that we talk about infection control is we try to knock out one of these arrows. If we can get rid of one of the arrows, we've broken the chain. So we'll ask, what's the weakest link in the chain, and try to knock out that link in the chain. That's the way that I think about this process. So you can list it out there. You've got the infectious organism, one of the ones that I just listed, right? Like let's talk about Giardia again, because we've got a real clear reservoir that can live in streams, right? It can live in water, so that's where that's its reservoir. Sometimes we talk about reservoir being an individual, like a person with tuberculosis is now a reservoir for tuberculosis, right? A portal of exit that has a way to get out of its reservoir. So you drink the water, right? Or the person with tuberculosis coughs on you. That's the portal of exit. Susceptible host. So the dork that was drinking the spring water would be that susceptible host, right? Or the person who inadvertently got coughed on by the tuberculosis patient would be that susceptible host. And some way for that to get into them. So drinking water, clearly it just passed through the mucous membrane of the mouth into the digestive system. Portal of entry with tuberculosis is going to be inhaling whatever little particulates there were that were coughed out of the patient, right? Pretty gross, but something you need to know. And then finally, that transmission of disease. It attaches into the individual and now begins the infectious process all over again. So it's one of those awful kind of cycles that just keeps perpetuating itself, right? And it spreads throughout the entire person. So some things to think about in terms of pulling those arrows off or trying to X them out. We've already talked about examples of ways to avoid creating reservoirs of infection. So what is a way in the hospital to avoid creating reservoirs for infection?
Wash your hands.
Wash your hands. Yeah, that's a number one, right? If we see spills, make sure that they're cleaned up appropriately, right? Cleaning off equipment after use as a way to destroy a reservoir of infection. What are some ways that we can avoid having a portal of entry? Things that we can do to avoid the portal of entry stuff.
Wear a mask.
Good. So if we're fitted for an N95 mask, that can definitely help X out the portal of entry right here with the face and the nose, right? Splash guards for the eyes with certain procedures. In the presence of blood, we might want to avoid the portal of entry through our eyes, right? And then also, I don't know if we mentioned it or not, but wearing gloves, right? Covering up wounds. Being aware if we have a wound or a burn, and avoiding those types of areas where the skin is not intact was also going to be a way to avoid both creating a portal of exit and a portal of entry. Now, one thing I want to talk about in terms of the susceptible host thing. So, in the hospital, we said the hospital would be a great place to work if it weren't full of sick people, right? Another way of saying that would be a great place to work if it wasn't full of susceptible hosts, right? Because what we're talking about now is a fancy word, nosocomial infection, which means that it's an infection that was acquired while the person was receiving health care, right? And the frank conversation that we have to have at this point is that we have done things in the medical system to actually create things like super viruses and super bugs, right? Because, for example, a person didn't finish their regimen of antibacterial medication, and now they've just created a super bacteria inside of them, right? We've done so many different inoculations for certain viruses like the common cold. Will the common cold eventually be what destroys humankind? Who knows, right? Because each year it comes back having learned lessons from the year before, right? And it's creating different strains and all these things. It's kind of creepy when you think about it. But those things that we have done to actually inadvertently create additional potential for infection among a susceptible population is what we're talking about when we talk about nosocomial infections, hospital-acquired infections. So that's on page 139 in the textbook. We also should probably talk about occupationally acquired stuff. And you might be thinking, well, that'll never happen to me. Guess what? That's the first way to make sure it's probably going to happen to you, right? Because I have legit known technologists who have gotten awful things. Personally knew them, right? Hepatitis. I've not personally known anyone who's gotten HIV, but I've known, had acquaintances who knew someone who had acquired HIV in the course of their work. So, a big question that we ask a lot up here is, how do we avoid that? Well, it's going to sound kind of goofy, but I'm kind of a big fan of Jordan Peterson. One of the first things that he says when he's talking to people about mental health and stuff is, how are you sleeping? And he's not so worried about when you go to bed at night as when you wake up in the morning. Do you wake up at the same time every day? That's actually a really important thing. It's critical to what we call circadian rhythms, the rhythm of serotonin reuptake in your body. So it's critical to brain health, right? And if it's critical to brain health, it becomes very quickly critical to the health of the rest of your body. So if you're someone who wakes up at odd hours, right? Just whenever, like one day you might wake up at noon, the next day you might wake up at 9 or something. Stop it. Pick a freaking time. Wake up at the same time every day. The next thing is, particularly if you're dealing with any kind of health issue, is eat a good breakfast. It's the most important meal of the day. Popcorn doesn't count. But what Jordan Peterson says is a breakfast that's high in fat and protein. I don't subscribe to that. I just go with the high in protein. But it is important, especially for mental health, to pick a time, wake up regularly at that time, eat a breakfast as soon as possible. The same is true for here. A healthy, well-rested body is your best protection. It's the best way to avoid occupational exposure, right? So getting all those things like the hepatitis vaccines and things help, right? But also taking care of your personal health is important. So I starred that on the page of 139. A healthy, well-rested body is your best protection. So there's a critical thinking skill there. How do I maintain a healthy, well-rested body while working in X job, right? While going to school and doing this. Okay, I'll kind of move through this because a lot of this we've already talked about. But again, in review, microorganisms are capable of causing disease, right? So we'll call those pathogens or pathogenic organisms in the ability to cause disease. And so we've got this table that lists those here, right? And you don't need to go through and memorize all these or whatever, but it is helpful to notice what is the mode of transmission. So if you see droplet or contact, those are the ones that we're particularly interested in the hospital. It's also one of the reasons we're not going around having sex with patients and stuff like that. So if that was in the back of your mind going into X-ray, just go ahead and cut that out. I was at a Bible study last night, and I was talking to this teenager, and there's another person at the table, and we were talking about is animal testing okay, yes or no? Because the teenager had a debate paper, and this other person at the table was like, and I couldn't see where they were coming from, but they were like, you know that like all koala bears have chlamydia? And I was like, what? What? And she pulled it up on Wikipedia. It was like 90% of koala bears have chlamydia. It's like they're sitting around eating eucalyptus leaves. They're like nature's kind of like, yeah, basically eating eucalyptus and passing chlamydia to each other. I was just like, I'm going to start just picking randomly cute animals and say that they have awful diseases. You know, like all chinchillas. They're so cute and cuddly, but, you know, they're all HIV positive. So that's what we're talking about when we talk about a reservoir of infection, right? The koala bear in that instance is the reservoir of infection. So it needs to be able to create a place where this thing can thrive, right? So moisture, nutrients, suitable temperature. It can be human or non-human, right? So in the Giardia case, I was talking about water in a stream, so that'd be non-human water. If you think water is a human, and we can talk after class. And then humans or animals, right? So the koala bear, the chinchilla. All right, a way to get out of that thing, either through the GI tract, an open wound, or the respiratory tract. And a susceptible host, that's you or me. Particularly someone who's immune compromised, like we mentioned with pneumonia, someone who's like that person in my family said, it just feels like an old lady disease. What were they saying? Well, they're saying, I must be more immune compromised now as I'm aging. Portal of entry. Now, this is something that we spend quite a bit of time thinking about in hospitals. Like, for example, why is it okay for us to place catheters in patients, right? Well, because it is primarily a portal of exit, right? Not much should be going into the body through the urethra. If it is, like, you might need to consult a psychologist. But for the most part, it is designed to be a portal of exit. So we can use a sterile procedure to place a catheter within the urethra. And since the body is primarily using that as a way to excrete stuff, we are not worried about it being a portal of entry, right? So these are critical considerations that we think about a lot. Is this an okay place to access this, right? Is this a safe access point for whatever, right? Whether we're talking about a surgical planning site or a procedure like I mentioned, the catheter. All right, transmission of diseases. And so I'm on page 140 in the textbook. So the most direct way to break the chain, right? It's not necessarily the weakest link, but it is an important one for us to be mindful of because it's one of the ones that we have the most direct control over. I can't control how immunocompromised Miss So-and-so is, right? But I can control all of these things here for the most part with certain procedures. So what we're going to talk about is direct contact, fomites, vectors, vehicles, airborne, and droplet contamination. So, direct contact. If you see contact isolation, there will be a sign that says contact isolation. And here's a hint. Here's something not to do if a patient's got contact isolation. So pretend this donut box is a patient. Hello, Mr. Donut. How are you doing? Let me check your name badge. What did I just do? I contacted this jerk. And what did he just do? He just gave me an infection, right? So don't do that. Like, don't get into a routine where you're constantly going around and checking people's name badges, right? You can ask them to show you their name badge or whatever, but don't go grabbing them. I've seen too many students doing that, and you're just setting yourself up to get MRSA, right? Why did I say MRSA? It's not on our list, is it? Is it on our list here? Examples? Methicillin-resistant Staphylococcus aureus, right? It's a skin disease that almost pretty much we can just assume everyone has, right? That everyone has got some staph on their skin. But we're going to avoid, we're trying to kill it with a methicillin, but it came back and said, guess what? I'm resistant to methicillin now. So don't go touching people if you see a contact isolation thing on there. You'll also notice the other two examples on here are sexually transmitted things, right? So, again, right? And it is helpful to understand that with HIV and AIDS, it is a contact thing, right? Because people start acting like if you got an HIV positive patient, that the boogeyman just walked into the hospital and that everyone's going to be magically infected with AIDS or something. That's not how it works. Like, you have to have had a sexual contact with that patient, right? Now, if there's blood involved, avoid the blood, right? But you can shake their hands. You can do all those things that you normally do with patients, right? Just avoid that sexual contact with them. It's not the boogeyman. Fomites. This is an object that's been in contact with pathogenic organisms. So contaminated gloves, the X-ray table, positioning sponges. And I've already mentioned pretty much one of the reasons why we're the redheaded stepchild of the operating room is we're the most filthy thing in the operating room. Why? Because of all the freaking fomites that we're carrying around. We're just a walking pile of fomites at that point. Vectors. These are things that we really love to hate. Like, to go back to the yellow fever epidemic and understanding where it came from mosquitoes, right? Mosquitoes who had been eating crap. And then they came and injected the crap into our bodies. Literally, that's the nicest way I can put it. So open sewers, the mosquito population was breeding in open crap. They came and they injected the crap into our bodies, right? And we got yellow fever.
From humans or animals?
The whole, I don't think they were sorting the crap out at that point. We've gotten into crap sorting recently. And Memphis now has the first modern sewers in the world, right? There was a man who came to town after the yellow fever epidemic. He said, I will make you beautiful sewers, right? And if you want an example of beautiful sewers, you can go downtown. We've got examples. There's actually a guy who does manhole cover tours at Court Square because of the beauty of our sewers. Things to be proud of. Choose 901. So, vectors. Vectors are the mosquito in that instance, right? Ticks carry Lyme disease, and it has to be a specific strain of tick. I think it's called the deer tick, right? I know this because I've had to pick ticks off of my body and off of dogs, right? But it's an arthropod, basically a bug, right, that has this junk inside of it and spreads it to a host. That's a vector. Vehicles. These are mediums that transport things. So they're not living things. So like food, water, drugs, blood. That would be a vehicle, right? Airborne. So tuberculosis is an example of something that we have to avoid, active tuberculosis, as an airborne infection. So people are sometimes in what they call reverse isolation, right? Where we're trying to collect all the organisms and the spores that are floating around in the room around this person, right? Because the stuff is capable of floating around in little droplets in the air, right? And it can stay up in the air for a long period of time. It's like it's going on a hot air balloon ride around the room, right? So just avoid those little tiny microscopic airborne transmission things. And some of these things, we've got data showing that they can resist dying for like weeks at a time, right? So just because the person's moved out of the room or whatever doesn't mean we're good to go. So there again is the example, TB being the primary one. All right. Droplet stuff. And this is one of the ones where it starts to seem like we're splitting hairs. So individual cough, sneeze, speaking, singing for some reason. If it's in the textbook, it literally means it happened, right? Someone was singing, and in the course of singing the national anthem or whatever, spread, what are examples of it? I don't have any examples right now, but some kind of microorganism. So where I say it's hair splitting is you have to get down to the micron level, right? 5 microns. Am I really interested in, and is the registry really interested in droplet versus airborne? No. But the significant thing here is just recognizing what we're primarily talking about with droplet is the flu, right? So if someone is coughing up mucus, avoid the frickin' mucus. If a kid sneezes on you, because kids love to sneeze on people, avoid the sneeze as much as possible. Watch those little kids. It's like they're walking around with like loaded shotguns for noses or something. It's disgusting. And the other thing is it will not travel far, right? So you've got to get sneezed on to get the flu, right? You can just comfort yourself with that every time you get the flu, like, I guess someone sneezed on me and their boogers went into my body. I need to be better about that not happening. Going back to shame. Okay. So examples, meningitis, diphtheria, pertussis, and strep pneumonia. So you'll notice pneumonia's got a bunch of little different things that we might have, but I mentioned the big one for us is the flu. It's the one that, again, how do we knock out, can we avoid people sneezing on us? Can we avoid the hanky-handing old ladies in the hospital? No, we can't, right? That actually is not the way we're going to knock out this part of the chain of the infection. What do? We remove ourselves as a susceptible host. We're not one of those people who is like anti-inoculations, right? If you join the anti-inoculation crowd, I will throw a desk at you, right? That was big in Texas while I was there, and it was just like, so folks who are against receiving inoculations because it's either a government mind control agent or it's going to cause something like autism. You know what I'm talking about? Generally over there with the vapor trail people as well. But yeah, no, inoculations are good things. Sorry if I offended anyone that's like anti-inoculation, but we just had like measles come back in America. That's crazy. Like that kills people, you know? So I don't know. Okay. All right, this is an important thing, and this is a critical thinking piece here. The body's natural defense, or the body's defense against infection. There is what we call natural resistance, and these are things like intact skin and mucous membranes. I worked at a hospital once, and I had a really gigantic beard, and it was in Texas. And they would not fit me for an N95 mask, but they wanted me to still be CTing people who had tuberculosis. And I don't know why I just didn't cut my dang beard. But it was just kind of one of those things. It came up, I had the beard, I thought, okay, that's great, now I don't have to do exams on anyone who's got tuberculosis. And they're like, wrong, you just get to do it minus a mask. I cut my beard shortly after that, after the first patient. So I had to go up, get a patient out of isolation with active TB and do their CT scan. What did I do? I'll tell you this, I didn't talk to that person very much. They might have thought I was rude, but every time I say something, I just opened up a mucous membrane, right? So in fact, I started holding my breath around the person as well. Because if you've ever been like painting a house or something like that, you know, you want to avoid that stuff getting into your body. You just close your freaking mouth and hold your breath. So that's what I did. What was I making use of at that point? Natural resistance. But if I'm around something that I suspect is potentially infectious, I can just kind of hold my breath, right? Close up the mucous membranes. Make sure that my skin is intact. Make sure that I'm covered, right? You walk around looking like a giant daisy because you got one of those yellow gowns on that they'll teach you how to use at the hospital. I don't care if I look like freaking Barney, you know what I mean? Like, as long as I've got my natural resistance there. Acquired immunity. This is what happens when you work through that process of shame because someone sneezed on you and their boogers went into your body and you got influenza. But guess what you just also got with the influenza? You just got acquired immunity, right? Once you've fought it off, God gives you a gold star in your chart and he says you don't have to get the flu again this flu season, at least not that strain of the flu, but I also invented other strains of the flu which you're not immune to, right? Because he's kind of a joker like that. But that's acquired immunity. When you've developed antibodies to a particular organism, in essence, your body learns how to fight this stuff. That's a very simplified version of it. It's actually one of the most interesting things about our bodies. So things like inflammation, where we increase blood flow to an area to allow for white blood cells to then engulf the infectious agent and go through this process of phagocytosis where it breaks down or it eats away at the infectious agent. We can create interferons, which actually kind of are like little prankster cells that mess with the way that viruses work, right? So there's a number of ways that our body can learn to fight off infection and acquire immunity to infection. Finally, passive immunity. And probably the best example of passive immunity is a child that is breastfeeding. Through the mother's milk, it is receiving things that are going to help it remain immune, but not for a very long time. You know, just in the presence of that breast milk. So that would be an example of passive immunity. That individual, that baby, does not have all of the immunity stuff that it needs going on, but it's receiving immunity agents from the mother. An example of that is we had a dog that was a puppy. When it was discovered, they found it out in the woods at Shelby Forest, right? And we adopted it. His name's Sandy. He's a really sweet little dog. But he got parvo. He had parvo, right? Which is a really pretty bad thing. It's like a blood-eating virus, I believe. Part of that infection is it's an opportunity. The opportunity for that infection occurs shortly after the puppy is weaned, right? That when it's no longer receiving the antibodies from the mother, it is now susceptible to parvo. As it gets older, it'll have a more acquired immune system and will be able to fight off parvo, right? So I'm telling you all that because y'all are college students, and every one of you, I'm sure, wants a puppy, right? At least that's the way I was when I was in college. Puppies are great. They're really cute. I like the little puppy breath thing. I'm not sure where that comes from. Just assume it comes straight from God. It smells really good. But the problem with puppies is you can't really take them anywhere, right? It's just like having a baby. You can't really take it anywhere. Why? Because it does not have all the acquired immunity that it needs. So do not take it right to the dog park. Like, don't go show it off to all your friends. Like, keep it kind of quarantined in the house until your vet says, yeah, you're good to go to the dog park, or yeah, you're making a face like I took my dog to the dog park.
I take her everywhere. Her immune system should be super
She should be by now. If you haven't killed her by now, she's probably fine. Yeah. Good. Yeah. But it is one of those things to be mindful of. Because of just these things right here. They may have the natural resistance, they may have intact skin and everything, but dogs do not keep their freaking mouths closed. They eat everything, right? And it's gross, which is why the puppy breath doesn't last for very long. But then eventually they will start to have acquired immunity. All right, thank y'all.